Good morning. I'm presenting my research paper titled Incidence and Risk Factors of Retinopathy of Prematurity in Preterm Infants, a prospective study done in a tertiary care center in northern Kerala. Retinopathy of prematurity is a vasoproliferative retinal disorder affecting premature infants, and it is a major cause of preventable childhood blindness worldwide. Now, there is a third epidemic of retinopathy prematurity in India, which is estimated to be due to an improved preterm survival but with variable neonatal ICU care. Incidence and severity of ROP strongly depends on birth weight and gestational age, whereas several neonatal factors and maternal risk factors are also associated. Indian studies report 18 to 33% of incidence of ROP. Region-specific findings are essential to refine screening guidelines and resource allocation for ROP prevention. Our aim was to determine the incidence of retinopathy prematurity among preterm infants, as well as to identify the perinatal risk factors significantly associated with its development. So we did a prospective observational study in a tertiary care hospital in northern Kerala from February to July 2025. 237 infants were enrolled in consecutive preterm infants undergoing ROP screening in our center, with birth weight less than 2000 grams and gestational age less than 34 weeks. Also, babies with gestational age 34 to 36 weeks with risk factors like oxygen therapy, more than 24 hours, sepsis, respiratory distress syndrome, etc. were also considered. Infants with major congenital anomalies were excluded from the study. First exam was done at 4 weeks postnatal age with indirect ophthalmoscopy, and the babies were followed up every 1 to 2 weeks until complete vascularization or development of ROP. And the ROP was staged and zoned as per ICROP guidelines. Maternal and neonatal risk factors were extracted from medical records. Now, the presence and stage of ROP was documented, and identification of independent predictors were also established. Data was analyzed. Descriptive statistics were analyzed using frequency percent and mean and standard deviation. Group comparison was done using chi-square test and students t-test with Welch correlation. Then a p-value of less than 0.05% was considered statistically significant. Multivariable analysis was also done with logistic regression to estimate adjusted odds ratios. These are my results. Among 237 screened preterm infants, 72, that is 30.4% of babies developed retinopathy of prematurity. Among them, 9 infants, that is 12.6%, had severe type 1 or aggressive ROP. 24.6% had stage 3 ROP, and 17.8 and 45% had stage 1 and stage 2 ROP respectively. The graph was showing the incidence of ROP was inversely proportional to birth weight, the first graph, and to with gestational age. Prevalence of risk factors in ROP infants. In low birth weight babies and gestational age less than 32 weeks, prevalence was high, as well as respiratory distress syndrome and oxygen therapy and sepsis. The babies who had these were also found to have statistically significant retinopathy of prematurity. On univariate analysis, low birth weight, gestational age, respiratory distress syndrome, oxygen therapy, as well as sepsis, they were found significantly associated with retinopathy prematurity. On multivariate logistic regression analysis, low birth weight babies, again gestational age less than 32 weeks, respiratory distress syndrome, and prolonged oxygen therapy, they remained statistically significant independent predictors of ROP. Now, the ROP incidence, which is around 30.4% in our study, it was similar to a study done by Ahuja et al., which was 32.6, and Kumar et al., which is around 18.5. Severe ROP was found to be 12.6%, which is also comparable to national ranges. Low birth weight and low gestational age, they remain the strongest predictors matching previous South Indian studies, whereas oxygen therapy and respiratory distress syndrome, they emerged as significant contributors, which is similar to our North Indian studies. Oxygen therapy is said to increase ROP risk due to oxygen saturation fluctuations, which can lead to abnormal angiogenesis. Now, RDS in this case also increases the need for respiratory support and oxygen exposure, as well as surfactant use, which indirectly elevates the risk of ROP. These are the limitations of our study. It was a single center study with short duration. Follow-up was limited, as well as there is potential documentation bias from medical record-based risk factor extraction. Concluding, ROP is remaining as a significant neonatal health challenge in India. Our study found 30.4% overall ROP incidence, as well as 12.6% incidence of severe ROP. Independent risk factors identified were low birth weight, gestational age less than 32 weeks, oxygen therapy, respiratory distress syndrome. Our findings reinforce the importance of judicious oxygen titration and early surfactant therapy in NICUs. We also need to support the need for region-specific ROP screening protocols and improved NICU standards. We also emphasize the importance of structured and timely ROP screening programs to reduce ROP-related blindness in the future. These are my references. Thank you.
Were those 237 babies intramural babies or extramural babies?
Intramural.
Then what I see is amongst the evidence, 1 in 3 child had RO. That is what you are saying.
Yeah.
Your incidence is
Yes.
30%, which is very, 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 very high.
Right.
I'm not sure whether any center will have that much high ROP because we don't think that much. Like almost one of every third baby having ROP is very big.
Most
Very big
of the
number.
preterm babies only, sir.
Yeah, of course.
Either stage
Of
1
course,
or
screening
stage
babies
2.
only. After
Yeah.
screened babies, you are saying that 1 in 3 are having and 1 in 10 are having aggressive ROP. That
1
is what
in 10,
your
yeah.
data shows. Both seem very, very odd. Do you know the Indian prevalence? National average?
It varies between 18 to 33.
Your state average?
Sorry?
Your state average?
State average.
Go check with it. And these numbers look very odd. So when you're presenting it in some forum or publishing it somewhere, then it will cause waves. This number will cause waves. So you'll have to
Most of them
double
will
check these
regress.
numbers. I'm sure this will not be, because we have done similar studies in Chennai and we don't have this much numbers. So please recheck that.